Good afternoon. I'm Alan Boone, Board of Directors for the AAST. Welcome to today's session. And today we're going to be talking about why CPAP is so critical. Our guests today are Julie DeWitt and Laurie Fordyce, both of whom happen to be on Board of Directors for the AAST. Welcome.
Hi.
Where would we like to start? What do you think? Why is CPAP so critical?
Probably should start with the importance of success for a patient. And there's multiple factors that are going to make this successful for a patient. Probably one of the most important is the interface. As if the mask doesn't work for them, if it's not comfortable for them, they're not going to be compliant with their therapy. So we have to make sure that we assess those patients appropriately. We want to look at their face structure. We want to look at what body position do they sleep in, do they travel a lot, are they claustrophobic, do they get anxiety, and we're going to take all of those factors into how we're going to fit them with an interface that will work for them.
Laurie, what do you think?
I think that, along with the interface, again, we do need to educate our patient and make sure, they understand why do they even need to use CPAP, and explain to them, this is good for their overall health and wellness. Maybe, they have hypertension that isn't treated properly, and how can wearing this machine actually help them with that?
Can you describe your stratification process and when you go through with a newly diagnosed CPAP patient?
So what we do is we, educate the patient on what is obstructive sleep apnea and why they need to use the machine. Mm-hmm. And then, just as Julie said, an important part of what we do is spending the time with them to figure out what interface that they need to use, maybe try them on while they're in the office with several different types of masks, on pressure, to see what could we send them home on as a first step.
So you get a patient that's been newly diagnosed, whether it be from the laboratory or come in through the HST route. Describe to me the process. How does your facility take and handle that, step by step, looking at, do you offer them the ability to lie down and take a small nap utilizing them?
We'll do that with a desensitization appointment. So for those patients, we'll take them back to one of the bedrooms. We'll let them lie down. We'll put the mask on. We'll have them go into the positions that they normally sleep in, mm-hmm. and see how that's working for them. And we'll put the therapy on what they need to have it on.
Looking at your patient populations and those in the community that you treat and continue to treat, can you tell me about one of your greatest successes? What was your greatest success patient that always comes to mind for you?
For me, when I was way back in the day when I was a young sleep technologist, I had a patient, and was one of those patients that is like, I am never wearing that thing on my face. And during the sleep study, you're sitting there by the bedside holding his hand, trying to get him to wear this. And at the end of his time, when he came back to see the sleep specialist, and this would have been a whole year later, and I just happened to be there at the time, this patient had lost 178 pounds, basically the amount of a man that he was able to lose just by going on therapy and adhering to it. And he said that he had his whole life back. There were some social issues in his life, and it just totally changed his life. And I will always remember that as my greatest success.
Those I think, are what drive us to do what we do.
Mm-hmm. Yeah.
Julie, how about you?
One of the patients that I think of right away is a patient that was hypertensive, out of control. Their bicarbonate levels in their blood was high, and they had heart arrhythmias and different heart disease going on. And once we got this patient, she was very reluctant to therapy, but she was a complex patient, multiple comorbidities, and she needed non-invasive ventilation. Her bicarbonate levels also decreased back to normal, and her cardiac disorders were more stabilized. And this patient stated she had not felt this good in years and couldn't have been more happy with the therapy.
Looking at the patient that's been diagnosed, that's been treated, and what are the long-term implications? What are circumstances that you've come across with making sure that patients remain compliant?
Well, for one thing, what if a patient has a massive weight loss? That's going to change the amount of therapy that they need. Maybe their medications changed, and medications could change the therapy also.
And I think that, patients should understand why they need to have resupply. Why maybe they need a new mask, because if their mask isn't fitting, and they've had it for 2 years, well, now they're going to get mask leaks. So those are important things to help them to understand that.
Ladies, thank you very much. I very much appreciate you coming in and participating in our series. And again, thank our audience for this. And we look forward to seeing you online again, and we'll see you in our next presentation. Good day.